Wisconsin is facing a crisis, one that in places like Milwaukee County kills more people than homicides, suicides, and car crashes combined. We're talking about drug overdoses and the role fentanyl plays in cases all across our state. Good evening, I'm Anthony DaBruzzi. Normally I bring you stories from our state capital, but tonight I'm taking a closer look at a lethal epidemic. If you're wondering what exactly is fentanyl, it's a synthetic opioid that's 80 to 100 times stronger than morphine. Pharmaceutical fentanyl was created to help cancer patients deal with pain management by using a patch on the skin. But like so many drugs, it's abused. That's because fentanyl can be made in a lab, and unlike opium, you don't need a field of poppy plants. Naloxone, sold under the brand name Narcan, is something you're also going to hear a lot about tonight. For the fortunate ones, it can reverse the effects of an opioid overdose in a matter of minutes and potentially save a life. Fentanyl-laced drugs are more common, more dangerous, and more lethal than ever before. Oftentimes masked to look like prescription opioids, many people don't even know what they are taking, putting just about anyone, anywhere at risk. That includes here in Wisconsin, where two UW-Milwaukee students died in the same dorm last year, just 9 months apart. Now their mothers, one from Pewaukee, the other of Waunakee, are teaming up to offer a word of warning, hoping your loved one doesn't become another statistic.
So good to see you. You found it, okay?
A best friendship formed over the worst kind of circumstances.
Hi, Red. Oh, so good to see you.
Aaron Rockwall and Michelle Coleman each lost a son to a fentanyl overdose last year. For Aaron and her husband Rick, heartbreak happened on Valentine's Day. They got a phone call that no parent wants to receive.
I know Rick was thinking, well, he probably overdosed and we're going to be headed to the hospital at some point. And I was like, I just knew he was gone. I don't know how to explain it.
And their son Logan was, at just 19 years old. His parents and younger brother trying to hold on to the good times.
Logan loved the outdoors. He loved his cats. He loved his family. He loved to play baseball. Great smile. Did you say that?
I didn't say the great smile, but he did have a great smile. He would always be the one making jokes and fun. And when he was younger, he got into magic cards, so he would do tricks for the family.
When Logan was 14, a doctor prescribed painkillers after a knee surgery. That's when it became clear how much he enjoyed being high. After that, a string of counselors and even out-of-state rehab.
We did not know at what level, and he would never be honest with us. So we would never be able to get out of him what he was doing. So it was constantly like a game.
It all came to an end when during a nearly 5-hour-long FaceTime call with his girlfriend, Logan took something and eventually passed out.
It was really hard to see him in his dorm,
Very difficult.
His bed was lofted, and he was just laying there like he just had fallen asleep.
Toxicology reports showed 3 different forms of fentanyl in Logan's system. Exactly what he took remains a mystery, but a police investigation into his death shows he had recently bought a Percocet.
It's kind of a shameful feeling, like what did we do wrong, and ultimately we've had to kind of settle with that. We know we did whatever we could. Ultimately, Logan had to make the choices that he made.
Only after losing her own son would Michelle learn of Logan's story.
Cade, from the moment he was born, was this amazing bundle of uncontrollable energy.
Cade Reddington will forever be 18. While out with friends last November, Cade took what he thought was a Percocet. Instead, it was 100% fentanyl.
He had no idea that this would kill him. No idea.
Police gave Cade 4 rounds of Narcan, but they couldn't save him.
He actually died in his dorm room, and his suite mates were there. He fell asleep, thought he fell asleep on a beanbag chair, and had no idea that he was overdosing.
Overdosing. It's a word Michelle is reluctant to use.
Because they did not knowingly take something, too much of something. They were poisoned.
I'm Michelle Coleman. My son is Cade Reddington.
Now on a mission to stop the stigma.
This is the alternative.
These two mothers are sharing their stories.
There's a lot of people out there that say, oh, well, they knew what they were, you shouldn't use drugs. You should also be able to make a mistake and live and move on to make better choices.
So no one else's has the same ending. Wisconsin saw 1,227 opioid-related deaths in 2020. That's the latest full year of data we have available. But those numbers truly tell the story. All genders, races, and even age groups are affected by the opioid epidemic, whether you live in an urban or rural place. Nobody is saying Wisconsin's opioid epidemic popped up overnight. Stats from 2015 show the state crime lab had just 51 fentanyl cases. That number jumped to 546 cases in 2020, a year dominated by disease. Brown, Outagamie, and Winnebago were among the worst impacted counties in northeast Wisconsin, which is why this next story takes us to Green Bay to find out how COVID-19 took such a toll. Andy Cohen wants to flip the script when it comes to teaching and talking about opioids.
I don't want to say that opioids don't have risks, because they do, but we know more now, and we also are more responsible.
The Bellin Health Pharmacy Clinical Coordinator says a lot of attention has been on getting physicians to prescribe fewer opioids. But now it's time to focus on illicit use, whether intentional or not. Cohen admits there was an upswing in overdoses before the COVID-19 pandemic, but that quickly turned into a spike.
We definitely had seen, from a time frame from 2020 to 2021, significant increases in opioid-related overdose deaths.
According to Cohen, more than 2/3 of opioid-related deaths are now tied to a synthetic drug, like fentanyl, something that's also causing more trips to the ER. Between January and April of 2020, Bellin Health treated just 2 patients for an opioid overdose in their emergency department, a number that jumped to 16 between May and August. By the end of the year, another 19 patients.
I would say the trends that I've seen over the last 2 years are actually people that have been in programming before.
As a substance abuse counselor, Alexis Hawk has had a front row seat to the impact of the pandemic. With more relapses over the last 2 years, the wait list at the Jackie Nitschke Center in Green Bay grew longer than ever before.
When everything started going back to in-person, like people weren't working from home anymore, that was a moment that there was quite an influx, because suddenly people weren't able to hide in their homes quite the same way that they were before. All of a sudden you have to go back to work, you're seeing family members again, and then it became much more evident that there was a problem. Again, you couldn't hide it quite the same way.
Back at Bellin Health, overdose visits to the emergency department have dropped off, at least for now. But the same can't be said for opioid-related deaths in the region.
You have a much stronger, more potent opioid that is potentially contributing to deaths. And the patients are never showing up in the emergency department with an overdose because they can't make it there.
Cohen says with fentanyl overdoses tougher to reverse, the outcome is often deadly. Fighting fentanyl will hopefully get a lot easier, with $400 million pouring into Wisconsin over the next 18 years. That's thanks to a lawsuit settlement involving 3 opioid distributors and 1 manufacturer. Wisconsin Attorney General Josh Kaul says the state will get more than $50 million this year alone. Those funds have to be spent on fighting the epidemic, with 70% going directly to local governments and the remaining 30% to the State Department of Health Services.
The funds are going to go towards fighting the opioid epidemic. There are a lot of different uses they can go towards, but it includes things like treatment, diversion, enforcement efforts, public education efforts. But the funds have to be spent on issues that relate to the opioid crisis. It's going to be different from what we saw with the tobacco settlements from decades ago, where a lot of states ended up spending the money on things that didn't have to do with fighting tobacco.
Those settlement dollars will be going in a lot of different directions, from treatment and recovery to prevention efforts. And in Milwaukee County, the medical examiner's office is using more technology to help spot new trends much faster. And they would like to buy more of that kind of equipment. Joining us now is Sarah Schreiber. She's the forensic technical director for the Milwaukee County Medical Examiner's Office. Thanks for being here, Sarah. 2021, another record-breaking year for overdose deaths in Wisconsin's most populated county. So what are you seeing?
We are seeing a tremendous influx of fentanyl. About 80% of our deaths contain narcotics, and those the most prevalent there being fentanyl or a fentanyl-related compound.
And so with seeing so much fentanyl responsible for these deaths, how are you using technology to track that trend?
So technology is a huge part, of course, of what we're doing. All of the biological material we receive from autopsy is subjected to that technological analytical evaluation. That helps us identify specifically what's responsible for the individual's death, whether that be a particular isomer, what type of opioid, you name it. But the accuracy we can put on that death certificate certainly provides the necessary data to provide policy change and give people information on what we're really looking to protect individuals from in this community and throughout the state.
Sarah Schreiber with the Medical Examiner's Office, thank you so much for joining us.
Thank you. Appreciate it.
Thanks for staying with us as we spend this half hour exploring how and why the fentanyl crisis is hitting the place we call home so hard. We know it's powerful, we know it's relatively cheap, but why is fentanyl being used as a filler if it makes drugs so deadly? And how is it reaching little towns and big cities in every corner of the state? To get those answers, we go to Eau Claire. Aaron Ranello isn't new to narcotics.
It's really hard to tell if there's fentanyl mixed in with it or not, and really from looking at it from the outside you aren't able to tell.
He's an investigator on the West Central Drug Task Force and says there are two big ways fentanyl is hitting so close to home. With more lax restrictions on chemicals in China, dealers are either having fentanyl shipped directly to their door using the dark web, or cartels are smuggling it into the U.S. across the Mexico border like any other illegal drug. At that point, you can think of it like a spider web, spreading to major hubs like Minneapolis and Chicago, where local dealers go to bring it back here.
They go to these bigger cities because they can buy larger quantities for a lower price. Then they bring it into our community and they can sell it for a more inflated price, and that's where they are making their money.
The task force Ranello works with isn't new. It was created in 1988 and covers 6 counties. West Central Wisconsin is considered a high-intensity drug trafficking area by the federal government, meaning more money and resources are being spent there to build bigger cases. Eau Claire sits right on Interstate 94, one of the major corridors through Wisconsin, running between Minneapolis, Milwaukee, and Chicago. Pair that with I-90 through La Crosse, and you can see why it's so easy to transport drugs longer distances in less time. Leaving Ranello to chase those chasing a high. He says fentanyl is all about getting people addicted, and those who peddle it aren't worried about killing so-called customers.
Dealers have been known to even market their products that say, my drugs are so good that it kills people. And as bad as that might sound, that's actually appealing to the user.
Appealing, and maybe just as appalling to hear for some. Fentanyl isn't just deadly for drug users. It poses a serious risk to our responders on the front line, too. Back on November 12th of 2019, Josh Eckes was working as a canine officer for the Rice Lake Police Department and was called to help with a routine traffic stop. After finding drugs in the car, officers brought the suspect out of the squad to search them. Eckes was standing downwind, just a couple of feet away, and suddenly could see a powder in the air.
And it was almost kind of like one of those old Disney movies where you see the wind kind of go like this. That was kind of what happened, and I didn't think of anything of it at the time. It just felt like a tingle in my throat, like a cough, like you need to get something up. And I went to cough, and when I went to cough, I couldn't get the air back.
Luckily, Eckes happened to be only 2 minutes from a hospital because he was experiencing a fentanyl overdose and was given 4 milligrams of Narcan. After that, Doctors would keep an eye on him for the next 6 hours. These days, he always carries Narcan while on duty and encourages everyone to be prepared for the unexpected. Whether it's pills, heroin, meth, even cocaine, towns and cities across the Badger State are dealing with their own drug dilemmas. But they all share one thing in common: a search for a solution. Let's look at how community leaders from Oshkosh to Madison to La Crosse are taking matters into their own hands and fighting the crisis however they can. You don't have to look very hard to find Narcan on the UW-Oshkosh campus. And that's how Police Chief Kurt Leibold likes it.
We don't have an overdose problem with UW-Oshkosh. As a matter of fact, since I've been here for the last 6 years, we've had one overdose situation.
And one life saved thanks to Narcan. Now you'll find it in something called a naloxone box. All 10 dorms have one, even places like the Student Union and Library. Leibold says they've been restocked about a dozen times since they were installed in November.
Fentanyl is now in so many drugs that you wouldn't expect it in. It's laced in marijuana. It's laced in pills such as Percocet, Adderall, things like that a college student may take, but they're certainly not using it thinking that they're going to overdose and die.
Just a little lever here that you turn and it opens.
Those boxes were donated free by a Madison-based group called Wisconsin Voices for Recovery. The program started in 2020 with 10 installs across 5 counties. This year, more than 100 are pending placement. For Director Cindy Brzezinski, it's all about safety and harm reduction.
You never know, somebody could accidentally take something or, not just unknowingly, and then there's fentanyl in it and they're overdosing, and then what do you do?
And what do you do after an overdose? That's a question first responders at Gunderson Tri-State Ambulance ask themselves.
Prior to this, the staff, when they were leaving these scenes, they felt like they weren't doing enough.
We make sure if we use it, we restock it.
Dr. Chris Eberlein calls them overdose safety kits. They include Narcan, a pocket mask, along with a list of resources. The ambulance service gives out about 2 of them a week, leaving behind kits for anyone who is high risk, whether out at a scene or discharged from the emergency room.
The goal is to keep these patients alive long enough that they can get into therapy, get into treatment.
Whether it's a box or a bag,
it really comes down to saving lives. That's what we're trying to do. People that have drug addiction issues, our job is to get them to the next day. Maybe the next day is when they go in for recovery or they start going to get some help.
The purpose is simple and a shared priority among these community leaders. Overdoses have reached a record high, not just in Wisconsin, but all across America. By now you might be wondering, what are those who represent us doing about the problem? With 1,227 opioid-related deaths in 2020, Governor Tony Evers calls fentanyl a scourge on our state and wants to see more investment in mental health. So far, $47 million of Federal American Rescue Plan Act funds have been put toward community programs for those struggling with mental health and substance abuse.
There's a workforce shortage in all sorts of areas across the state. I can't think of one that is more important than having more people becoming trained mental health folks so that we can deal with these issues before drugs become an issue.
In mid-March, the governor also signed several bills into law, which include stiffer penalties for making, distributing, or delivering fentanyl, as well as a new system to track and collect data on opioid and meth use. But Evers says of the 3 bills he signed, the one legalizing fentanyl testing strips could do the most. Clinics and health departments across the Badger State patiently waited for that state law to change. Though fentanyl testing strips are pretty cheap, Using one could have cost you a felony, at least before March when they were decriminalized. We take a closer look at how a piece of paper could help keep someone alive long enough to get treatment and recovery.
This here is enough to kill somebody in one dose.
State Representative Jesse James doesn't just make laws, he enforces them too.
If it saves one life, that's a win. That's a victory for us in the state legislature. That's a victory for our communities. That's a victory for our families because they're not losing a loved one to an overdose death.
James authored a bipartisan bill to legalize fentanyl testing strips, a tool he feels will not only save lives, but taxpayer dollars too.
By avoiding an overdose call, because the user would test the substance, see if there was fentanyl inside of it, and either choose not to use it or use a less amount of it.
We would give them the syringes, we could give them ties.
Vivint Health also gives its clients fentanyl testing strips and has since 2019. No longer considered drug paraphernalia, Director of Prevention Services, Kristen Grimes, hopes more people will be comfortable using them.
The people that we serve do not want to die. They want to live, and so they want to know what's in their drug supply. They want to utilize those safer behaviors to reduce their risks of overdose. And we open up the fentanyl test strip.
The small strips of paper cost about $1 and can detect if fentanyl is in a drug, whether it's a pill, powder, or something else.
And then you let it sit for a minute or two.
Last year, Vivint Health distributed more than 45,000 of the test strips across Wisconsin, not to support those who choose to use, but to reduce the risk of an overdose.
We may not know it, but we generally are aware of someone in our circles that use drugs. And they're going to use drugs regardless of whether or not these strips are legal or illegal. They're going to use drugs. And this is a tool that we can provide them to help them use as safely as possible and keep them alive until they're ready to recover.
Recover, just like James did.
I myself am 24 years sober, and it's a choice that I made. And yeah, it's a battle.
And it's a battle he hopes to make easier to win for those struggling for a second chance.
Any way we can improve the environment of our communities in Wisconsin, and I don't care if it's urban or rural, it's a victory for all of us.
All of us who are fighting to save one life at a time. Action from the Capitol, whether in Madison or Washington, D.C., will only go so far. To tackle a crisis like this, conversations need to be had in the communities where we live. Appleton-based nonprofit Rise Together focuses on preventing addiction and promoting mental health, and here to help us have some of those conversations is the executive director, Nadine Miskovich. Thank you so much for joining us today, Nadine. And tell me a little bit about why you've built this whole movement around young people.
Because the future is youth. Period. I do have to say we got started as individuals in long-term recovery. Back in 2013, we were really on a mission to spread awareness because there was a 60% increase in heroin-related overdose deaths at that time. And as an individual in recovery, I realized, how important it is for us to speak out about what was going on at the time.
We hear these stories, but I feel like we don't actually talk about them. So why aren't conversations being had?
Conversations are being had, but unfortunately they're being had behind closed doors or in basements or at funerals or at angelversaries or life celebrations, typically after the fact. By us sharing stories, doing educational pieces like this, spreading more news and awareness, that's how we're going to be able to combat the crisis. Because when we not only share education, but we also tell our stories. And stories build that meaningful connection, which also builds empathy. It also builds compassion. That's what we need more from people who don't really understand how this crisis is truly impacting everybody.
Absolutely. It all starts with normalizing those conversations. Nadine is with Appleton-based Rise Together. Thank you so much for joining us.
Thank you so much for having me.
We began tonight's look at the fentanyl crisis with a story of unimaginable loss for two families. A special thank you again to Rick and Aaron Rockwall and Michelle Coleman for courageously sharing their stories. And thank you for joining us to hear them. For all of us here at Spectrum News, I'm Anthony DaBruzzi. Good night.